need to unleash the full power of science to deliver innovations that are scalable, usable, and benefit everyone, everywhere, at the same time. Traditional market models will not deliver at the scale needed to cover the entire globe. Solidarity within and between countries and the private sector is essential if we are to overcome these difficult times. Now is the moment where leaders must come together to develop a new global access policy and an operational tool which will turn the many good intentions expressed in recent weeks into reality. We're seeing some good examples where companies are coming out with solidarity approaches, from open licensing and support to tech transfer via the new Tech Access Partnership, to commitments not to increase prices in times of shortages. WHO recognized the wide-ranging efforts and initiatives aimed at incentivizing innovation while also ensuring access for all. These will be important topics next week at the World Health Assembly. At the beginning of the pandemic, President Alvarado asked me to set up a health technology repository for vaccines, medicines, diagnostics, and any other tool that may work against COVID-19. WHO has accepted this visionary proposal from His Excellency, President Alvarado, and will, in the next few weeks, launch a platform for open, collaborative sharing of knowledge, data, and intellectual property on existing and new health tools to combat COVID-19. Next week, one of the most important World Health Assemblies will take place since we were founded in 1948. I'm looking forward to greeting and working with leaders from across the world to ensure that together we optimize the COVID-19 response and build back stronger health systems. Over the past few months, across the world, we have shown that when countries implement a comprehensive strategy, they can effectively contain and suppress the spread of the virus while minimizing the impact on lives and livelihoods. The pandemic has shown again, and in the strongest way possible, that investing in health is not just the right thing to do, it's the smart thing to do. There is no trade-off between investing in health and your economy. Health is an investment in our collective future. Funding quality health for all doesn't just save lives. It means children are healthy and can go to school, people can go to work to earn a living, and societies and economies are both stronger and more sustainable. Yesterday, WHO released a policy brief on gender and COVID-19, which encourages countries to incorporate a gender focus into their responses. It includes 6 key asks for governments. First, when recording cases, collect both age and sex disaggregated data. Second, prevent and respond effectively to issues of domestic violence which have been exacerbated by the pandemic. Third, encourage availability and access to sexual and reproductive health services. Fourth, protect and support all health workers, approximately 70% of whom are women. Fifth, ensure equitable access to testing and treatment for COVID-19. And finally, sixth, ensure responses are both inclusive and discriminatory. To maximize effectiveness and ensure that no one is left behind, tackling the pandemic requires a gender-responsive, equity-oriented, and human rights-based approach. This evening, WHO will release a scientific brief on multi-system inflammatory syndrome in children. In the past weeks, reports from Europe and North America have described a small number of children being admitted to intensive care units with a multi-system inflammatory condition with some features similar to Kawasaki's disease and toxic shock syndrome. Initial reports hypothesize that this syndrome may be related to COVID-19. It's critical to urgently and carefully characterize this clinical syndrome to understand causality and to describe treatment interventions. Together with our global clinical network for COVID-19, WHO has developed a preliminary case definition and a case report form for multi-system inflammatory syndrome in children. I call on all clinicians worldwide to work with your national authorities and WHO to be on the alert and better understand this syndrome in children. I will repeat this. I call on all clinicians worldwide to work with your national authorities and WHO to be on the alert and better understand this syndrome in children. I thank you.